Hi, I'm Dr. Mark Faber, and we're going to talk about the role of antidepressants in treating depression, and indeed a number of these medications are used to treat anxiety as well in children, adolescents, and adults. It should first be noted and highlighted that there is significant value in the non-medication strategies, particularly psychotherapy, including cognitive behavioral therapy for depression and anxiety. That would be considered an additional topic in and of itself, but suffice to say, it's very important to know and acknowledge that there are psychotherapy interventions for addressing depression, and also lifestyle interventions, including exercise and appropriate diet. I'm now going to provide an overview of the antidepressants in treating depression, and indeed these medications can treat anxiety as well. These antidepressants are within certain groups, and the groups are often based on mechanism of action. So one category may increase serotonin in the brain. This is a chemical messenger that includes what we call the SSRIs, the serotonin selective reuptake inhibitors. A second group includes the SNRIs, the serotonin norepinephrine reuptake inhibitors. A third group may impact on dopamine and norepinephrine. And so there are these, and as we will see going forward in the future, other potential targets of the antidepressants. In terms of the effectiveness of these medications, it is known that if we identify the right medication, provide the proper or the right dose, and treat for the appropriate or right amount of time, we can see a very good response to medications, where studies indicate certainly a 60% plus response with antidepressant medication. In addition, we know, however, there may be side effects to these medications, and we always want to balance the risk versus the benefit of these medications. Common side effects as a group include headache, stomach upset, a little extra energy, maybe what we call activation, and in some instances the medication may potentially trigger not just activation, but a shift from low mood to what we described earlier in terms of mood dysregulation or bipolar switching. In order to minimize these side effects, we want to start at a very low dose of medication, adjust it upward carefully, and monitor the individual closely. Antidepressant use, particularly in children, adolescents, and young adults, has also been associated with one potential risk, that is the increase in suicidal ideation. It should be noted that this risk is felt to be low, in the 2% range, and we are talking about thoughts, not typically actions as a result of taking the medication. With that said, we always want to monitor again closely and advise families, certainly for children, adolescents, and young adults up to age 24, that this may occur. It may be associated with something that we describe as feeling very uncomfortable, more agitated, more irritated, and just discomfort in terms of sitting for long periods. That is called akathisia. And so we will provide this information ahead of time, start the medication at a low dose, and adjust it upward carefully. In monitoring and in initiating the medication when it is felt to be indicated, namely in depression that is typically of moderate or severe intensity, then we can do our very best to assure that these medications are used safely and are provided in a way and with a strategy that will be effective. Thank you.